Hello there, welcome to ShineTech's YouTube channel, and in this video I'm going to go through multiple choice questions on the mediastinum. Question 1. Which one of the following is found only in the superior mediastinum? A. The trachea, B. The vagus nerve, C. The thoracic duct, D. Descending aorta, and E. We have the splanchnic nerve. So which one among these is only found in the superior mediastinum? So the mediastinum is a cavity found in the thorax, and it is divided into two, which is the superior and inferior on the sternal angle, which is opposite to level T4. So the superior and this is the inferior, divided by the transverse thoracic plane, and the inferior mediastinum is divided into three, which are the anterior part, this part, and then we have the middle part and the posterior mediastinum. So meaning we have about four divisions of the mediastinum. So our question is asking to identify the structure which is only found in the superior mediastinum, which is only in that part of the medial sternum. So on these structures here, the trachea is the only structure which is found in the superior mediastinum. Why? Because when it reaches on T4 here, it is going to bifurcate into two principal bronchi at level T4. So 1, 2, 3 at T4 here, it is going to bifurcate into two. So it is only found in the superior mediastinum. So our correct answer is A. We move on to question 2. So question 2 reads, which one of the following is found both in the superior and posterior mediastinum? So which one of the following is found both in the superior and posterior mediastinum? A. Heart, B. Trachea, C. Esophagus, D. Phrenic nerve, E. Pulmonary trunk. So which one is found in superior and posterior? So as I have already said, we have the superior and the inferior mediastinum, which is the inferior is divided into anterior, middle, and posterior. So which one or which structure is in both superior and the posterior mediastinum? So on our choices here, the only structure which is in the superior and posterior mediastinum is the esophagus, because the esophagus comes from C cervical vertebrae number 6, and it passes in the thorax, okay, that is in the superior mediastinum, and it also passes the diaphragm to go into the abdomen. So as it passes through the thorax, it's going to pass through the superior mediastinum and the posterior mediastinum. So the esophagus is the correct answer. It is found both in the superior and posterior mediastinum. So we move on to question 3. Which one of the following is located in the anterior mediastinum? A. Thymus, B. Esophagus, C. Arch of aorta, D. Descending aorta, and E. Right atrium of the heart. So anterior mediastinum. So in the anterior mediastinum, you are going to find the thymus. The thymus is simply a gland which produces T lymphocytes. Okay, it produces T lymphocytes which are involved in the immune system in the human body. So it is found in the anterior mediastinum, especially in kids, in children, and in grown adults. It is converted to adipose fat tissue. So, but in children, it is in the anterior mediastinum. So, the correct answer is the thymus. It is found in the anterior mediastinum. So, we move on to question 4. Question 4. The thymus in the thorax is related anterior to the A. pleura, B. arch of the aorta, C. superior vena cava, D. internal thoracic artery, E. left brachiocephalic vein. So which one among these is related anterior to the thymus? Okay, so the thymus is in the anterior part of the thorax, the anterior part of the mediastinum. So the anterior mediastinum. So in the anterior, so anterior to the thymus, we are going to have the internal thoracic artery, which is this artery here. Okay, so the anteriorly, it is related to the internal thoracic artery. Arch of aorta, it is in the superior mediastinum. The internal thoracic artery, it is anterior, and it is in the medial. It is in the anterior mediastinum, so it is passing, or it is related to the thymus anteriorly. So the correct answer is D. Question 5. The pulmonary trunk carries deoxygenated blood from the dash of the heart to the lungs. A. left auricle, B. left atrium, C. right atrium, and D. left ventricle, E. right ventricle. So the pulmonary trunk carries deoxygenated blood from the dash of the heart to the lungs. So in this diagram here, we have the pulmonary trunk. This is the pulmonary trunk, which bifurcates to form the left and right pulmonary arteries. So it carries deoxygenated blood from this ventricle here, which is the right ventricle. The right ventricle receives blood from the right atrium. Okay, so it receives blood from the right ventricle here, and that right ventricle, as it contracts, it pushes that blood into the pulmonary trunk. So the correct answer is the right ventricle, which is E. So question 6. The pulmonary trunk is first ascends dash to the ascending aorta. The pulmonary trunk is first ascends dash to the ascending aorta. A. deep, B. inferior to the ascending aorta, C. superior, D. posterior, and E. anterior to the ascending aorta. So let's look at the pulmonary trunk. So the pulmonary trunk, as I already said, it is this trunk there. So as we can see, as it is ascending, it is passing anterior to the ascending aorta there. Okay, so it is anterior to the ascending aorta. Okay, so the correct answer is E for question 6, because the pulmonary trunk is first ascends anterior to the ascending aorta, as we have seen in this diagram here. It is anterior to the ascending aorta. So the correct answer is E in this case. So question 7. Which one of the following parts drain lymph into the right lymphatic duct? A. uterus, B. left hand, C. right foot, D. small intestines, E. right cubital fossa. So which one among these choices here drain lymph into the right lymphatic duct? So this is the cubital fossa, and in this diagram here we have the lymph ducts, then we have our right lymphatic duct, which is this duct which is draining into the right brachiocephalic vein here. So that duct is draining the upper limb, the right upper limb or the right arm and forearm through the subclavian artery, and then it is draining the head and neck through the jugular trunk there. Okay, so it doesn't drain the uterus and other parts, but it also drains the thorax via that duct there, which is the brachiomediastinal trunk. So coming back to our question, they are saying which one among these choices here, okay, drains lymph into the right lymphatic duct? So left hand, no, because the right lymphatic duct, it is at the right side and it is going to drain the right hand, not the left. Then the foot, it doesn't drain the foot, small intestine, it doesn't drain small intestine, it only drains the head, the upper limb, and the right hand, and even the thorax, okay, for the right lymphatic duct. So the correct answer here, the only possible answer can be the right cubital fossa, because the cubital fossa is simply a fossa which is formed in between the arm and the forearm, and it is bordered by the pronator teres and the brachioradialis muscle. These muscles here, and then the upper border here there is simply the transverse line in between the epicondyles of the humerus, the medial epicondyle and the retroepicondyle. The line which is drawn there, it is going to be the base of this cubital fossa or the cubital triangle. So it is part of the forearm. So the right cubital fossa can be drained by the right lymphatic duct as it drains the right upper limb. So the correct answer can only be E in this question here. So question 8. Question 8, the pulmonary trunk divides anterior to the dash into right and left pulmonary arteries. The pulmonary trunk divides anterior to the dash into right and left pulmonary arteries. A, arch of the aorta, B, descending aorta, C, left principal bronchus, D, right principal bronchus, and E, bifurcation of the trachea. So the pulmonary trunk, it is going to divide into left and right pulmonary arteries. Now that bifurcation is anterior to which structure? Is it to the arch of the aorta, or to the descending aorta, or to the left principal bronchus, or to the right principal bronchus, or the bifurcation of the trachea? So in this diagram here, you can see this is our pulmonary trunk. So as it bifurcates, it is anterior to the left principal bronchus. So this is the left primary bronchus. It is also called the left principal bronchus, which is posterior to our pulmonary trunk there. So we can say the pulmonary trunk bifurcates, divides anteriorly toward to the left principal bronchus. So the correct answer is C, as we have seen in this diagram here. We move on to question 9. The left bronchocephalic vein is located posterior to the left bronchocephalic vein is located posterior to the A, thymus, B, left subclavian artery, C, brachiocephalic artery, D, left internal thoracic artery, E, left common carotid artery. So the left brachiocephalic vein is located posteriorly to the thymus. It is anteriorly to all these arteries here. So this is the left brachiocephalic vein here. So this vein is anterior to all those arteries which are there, meaning all the branches of the aortic arch is anterior, they are posterior to this vein here. Okay, but the question is asking for the posterior. Okay, so is located posterior to the thymus. The correct answer is A. For all these arteries are posterior to this vein. Only the thymus is anterior. So meaning the brachiocephalic, the left brachiocephalic vein is located posterior to the thymus, behind the thymus. Question 10. The azygous vein A drains into accessory hemiazygous vein. B is the continuation of the left subcostal vein. C communicates with the vertebral venous plexus. D passes close to the left side of the vertebral column. And E runs through the esophageal opening of the diaphragm. So the azygous vein communicates with the vertebral venous plexus, okay, and it runs through the aortic, not the esophageal opening, but the aortic hiatus of the diaphragm. And then from there, it doesn't drain in the accessory hemiazygous, but it drains into the vena cava. So the correct answer is C. It communicates with the vertebral venous plexus. So these plexus are the ones which drains the vertebrae bones or the vertebral column. Those are called the venous plexus, the vertebral venous plexus. They communicate with the azygous vein. So the correct answer is C. Thank you so much for watching. Don't forget to like if you like this video, and subscribe, and leave your comment concerning this video in the comment section below.